my co-host with me,
Amisha.
Amisha, and soon we will be joined by our another co-host and guest, Anish from North Carolina, Charlotte. So, so Amisha, today we are um, we are talking about unmasking a fact,
Yeah.
right? Unmasking a fact, and it is about why we need to be covered, right? So, as we all have been going through for the past couple of months, the dreaded word coronavirus, right? So, there are many guidelines that we are required to follow, and it's globally. It's not just one person's problem, it's a pandemic. So today we thought that why not talk about or through our sharing our perspective on why we need to stay covered around the confusion that is going on around whether to wear mask or to not wear a mask. So before even we start get into this CDC that we follow, which is Center for Disease Control, right,
Yep.
in the US. And what initially CDC had said that no, if you're okay, if you're fine, if you're not sick, then you do not have to wear a mask. Let somebody who is affected or infected with the virus can wear a mask, right? But then over a period of time, it's been, especially in the US, since the time if I remember correctly, like mid of Feb, but it's actually around March time when all these, wearing mask and following guidelines and stay home, things like these came into effect. So initially, CDC, as per CDC, it was said that don't wear mask, and then later, now wear mask, right? So what is it? What is it that the confusion? Are you still confused whether wearing mask or
Nope.
not? So do you wear mask when you go
Yeah, every
out?
time I step out of the house, I have to wear a mask.
So yes, there are many things that a mask one should wear. It's prevention, right? There's an old saying which says prevention is better than cure. So not only following the guidelines, but also using our own judgment, right? Uh, as we call it, the common sense that we can use to prevent ourselves and to prevent from spreading the disease. That it's very important that we wear mask, and that's what our topic is. So, Amisha, amongst your friends, have you received any kind of questions, or do you talk about these things that why should I wear mask, or coronavirus? It's been long, and we are from New Jersey, so we don't have any problem anymore. So, do you have these kind of talks that go on?
Not really. Everybody knows pretty much that you really need to wear a mask until everything is 100% safe. And yeah, of course, people complain sometimes. Like my friends have been complaining that oh, it's hot and like it's hard to wear, but we all know that you have to wear it.
So we have Amisha. We have been joined by Rima, who has joined us from India, Mumbai, India. Hi, Rima. Please say hello to all our.
Good morning, good evening, everyone. This is Reema from Mumbai, India.
Thank you, Rima. Now, Rima is from Mumbai, Maharashtra, which is again just like how it all started here in New York City, New Jersey, which became an epicenter of the COVID 19, of the disease. And wow, we have also been joined by Anish. Hey, Anish, we were waiting for you. Great. So, Anish, say hello to all our viewers and say hello.
Hi everyone, I'm
Great.
Manish.
And
I
then,
live in Charlotte right now. Hope everyone is doing well.
great. So, Anish, this is really very interesting because, see, we are from New Jersey. Rima has joined us from Mumbai, Maharashtra, India, and
Hmm.
you are in Charlotte, North Carolina. So, interestingly, the state of New Jersey, where we were in a terrible panic situation because we were the epicenter because we share border. We are just close to the city, New York City. And then
Mm-hmm.
now it is said that we are in a much better state. And then Mumbai, India, which is, I think it's still at the top of, it's still at the top of where most coronavirus, COVID cases have been registered, right, Rima?
That's right. So it's almost above more than 3 lakhs
Wow.
positive cases as of now are being counted.
Wow. And then if we move on to a little southern, which will be Charlotte, North Carolina. So how is it going on in North Carolina, especially Charlotte, where you're from?
So
Any?
it's really bad right now in Charlotte.
Okay.
Every day the number of cases seems to rise.
Oh my gosh. And that's not good.
No.
That's not good.
Yeah, and the predicted peak has been shifted to October, which was supposed to be in June.
Wow. So you Anish, you made a very good point because we want our viewers also to understand what do we mean by some of us. Most of us know, but why did how is this that delayed peak? We will discuss this later at a later part. However, to begin, since Rima and you just joined us, and Amisha and I, we were in conversation as to why mask. Why?
Mm-hmm.
There had been too many confusions um, developed because CDC had announced CDC, which is Center for Disease Control in America. Originally, it said that hey, you know what? If you don't have to wear mask if you are fine, if you're healthy. But later on, as the disease, as the strain of the virus also evolved, and as more research is into progress, and new findings are coming out that why to wear mask, and now everyone is recommended to wear mask. So we chose the topic today that do we need to wear why do we need to stay covered, right? And there were certain things I was asking Amisha if her age group friends, if they talk about if they are talking about whether to wear mask or not, to which Amisha said that no, they're very particular. Their age group is very particular about wearing mask and its importance. So, Anish, I'd like to know that does any of your friend still is going through that confusion of whether to wear a mask or not, or in your circle?
So right now everyone in my circle has been wearing masks, but I still remember that I was one of those people who used to think that mask won't really protect us because initially the CDC had said that, or I'm sorry, the WHO had said that
Right?
this disease is not airborne.
Mm-hmm.
Yeah, so at that point of time, I remember everyone used to be like, mask won't save you. And I was one of those people because I read some of the headlines
Correct.
stated by WHO.
World Health.
WHO is the World Health Organization.
Yes, correct, correct. That's right. But as the disease is progressing, as it is, I would use the word evolving. So our learning is also evolving, right? What
True.
worked well 4 months
Might not.
ago, yes, it may not work right now. So we have still certain confusions going on around, and we are going to talk about that. So, Amisha, what do you have? Uh, what do you think?
Well, to start off, basically, a lot of people, despite the research that has been published and news that's been published by the CDC and other organizations, people are still not willing to believe that masks are necessary, or at least are one of the things that are necessary to stop the virus. And that's for a bunch of different reasons, which we've kind of compiled a few of them, and we're going to be discussing them. So, one of them is that you don't need to wear a mask when you're sick. So, this is one of the myths because this is not exactly true. The point is that the point of wearing a mask is not just to protect yourself, it's to protect other people. Because when we talk, we're basically releasing like particles and stuff into the air, and people can get infected from that other people, which is why it's so important to wear a mask when you go out in public or go grocery shopping or anything like that.
So, what do you think, Rima? I know that you have been taking care of your um, elderly parents, my parents as well. So everything is on to you, right? So as a caregiver, what is the kind of guideline that you have in where you are, and why and how do you think wearing a mask, like Amisha said, that if you're not sick, you look healthy to me, so why wear a mask? We'd like to know your perspective on that.
First of all, most of us are not aware if we are really infected because of this. So, so I mean, like when we are not aware, we are not sure why to take risk. In my case, like my old parents, senior citizen, they are living in the house. So first of all, like I ensure, because most of the cases I'm going out for all the work I do for the house, for the grocery, for the vegetables and other stuff for which I'm going out, even the courier people who are coming and delivering stuff at my lobby. So for that, I need to go out, and I ensure that I'm wearing mask, gloves in my hand, and I protect myself in such a manner that, like, because I feel the senior citizen people, they are more prone, their immunity level is very low. So just to ensure that they are not affected because of me going out, though I keep a distance with them, and coming back home, first thing which I do is just to, like take out my mask, remove my gloves, I throw it because those are disposable gloves I use. Masks, I just take out, I wash it. I wash my hand, I sanitize myself completely. And then, I even, the clothes which I'm wearing, that I put it into for cleaning, I clean it. And then I do the other stuff, other work, just to ensure that my parents are not getting affected because of this. So that kind of thing is very much needed. So mask is there for everybody at home, but that the scenario is different. That my parents, they don't have to wear it because I'm not allowing them to go out. But given a situation, there are people who don't have caregiver or their young children to take care of them. They are of their own. In that case, they have to go out, but it's very much important for them to wear mask and cover themselves in such a manner that they are not affected. So that is a precaution we are taking, and it's very much important. Yes, masks are definitely important, and keeping a distance also with the people, that's important.
Thank you, Rima. You just um, proved the old saying that we all used to, we learned as we were growing up, that prevention is better than cure. So if you're not sure whether you have it or not, it's best to just prevent. And how you can prevent is, of course, when you're going out, why not just wear the damn mask? Why not? So I would wear it, and I wear it. And I said this because yesterday, during my show, I was in a live studio. However, there's nobody there. And it's my own conscious. I know that, the organizer, the program coordinator, and everything, they have kept all sorts of, the disinfecting wipes, and they're trying to maintain the social distancing by not keeping the talk host, there's a hour gap between them, all those things. But it's my own self conscious that tells me, my awareness tells me that, hey, I better wear my mask, because I'm not, you never know. So just as a precaution, I wore mask. And yes, prevention is better than cure. I'm not sure. So why not only making sure that I'm fine, in this case, Rima's case, that making sure that I'm fine, I'm also, I don't know if I have it or not, but I'm also helping in not spreading the infection. And it is not just the coronavirus infection, it could be any other airborne, germs that I may have. I'm not spreading it. And then I'm also at the same time making sure that once I'm back inside, and I have elderly parents with me, or somebody who I take care of, and who are at a very, they're vulnerable. Their age makes them more vulnerable. So I'm also making sure that I do not carry something unknowingly and I pass it on to them. So thank you so much. And Anish, we'd like to know from you your perspective on this. So please go ahead. Please unmute. Yeah, unmute yourself. Yeah.
Yeah, so I do think what my mom said is 100% correct, as well as what you said. At this point of time, I truly believe that people should only go out if it's super necessary. If not, stay home. That will not only protect yourself, but you don't know when you go out who comes near you. That person might be elderly, and
Correct.
you might not even know if you have the disease or not.
Yeah.
Yeah, so, and of course, do maintain social distance. And if you have to go out, then please wear a mask. It doesn't it doesn't protect it doesn't only protect you, but it protects others from you.
Correct.
So yeah, I that's what I have to say. So yeah, please.
That's a very, very important point. So here I'd like to have our viewers also. You can write to us. Please send us your comments. What do you think? And what is it that we have? Sometimes it is said that I do read where it says that, okay, fine, you know what, I can party around and I can go out because I'm wearing a mask. So I've already done my job. So is that okay?
Definitely not.
I mean, come on, the life has it. My life has, it's like a completely opposite turn it has taken. And if I'm a social person, I like to be with my friends and family out there, and I can't do it. So if I wash my hands, if I just wear a mask, I can still do all these things. So do you think that's because many think like that? And how I know is that, it's in the news, it's in digital, print, everywhere. That why so many people are dying also. It's serious. Come on. So what do you have to say on that? You're a young woman. You were in college. You'd like to go out with your friends and party around. And don't you want to do that, Amisha?
Yeah, definitely. And on top of that, like one, it's summertime, so of course everybody wants to go out, and a lot of people have birthdays, so they want birthday parties. But um, the thing is that it's just more important to be safe than just hang
Sorry.
out or have a birthday party at this moment.
Or better to be
Um,
safe than
yeah,
sorry.
exactly. Um, and that's another myth, that you don't have to social distance if you're wearing a mask. That's not true either. The mask is just one step to being safe. So you still have to maintain all the other precautions. You still have to take them. Social distancing whenever possible, and frequently washing your hands. So just wearing a mask isn't like solving everything.
Correct, correct. When I look at Anish, a young man, just like as I said, Amisha, um, you know, it's summertime, right? And if I'm not mistaken, you had been to Miami and Key West and Florida for the spring break, right? And did you just get lucky just before coronavirus and the pandemic took place? And would
I
you like?
re- I remember you calling me when I was in Miami and saying that please be safe. Coronavirus is taking over. New York is almost shut down. And at that point of time, I remember saying to myself that nothing's really that serious. That was my mindset at that point of time.
Right.
But then when I came back to Charlotte, my school shut down. And that's when I knew that stuff is getting serious.
Yeah.
Of course, I want to go outside with my friends. Of course, I want to party. But at this point of time, I know what's important and what's not. And it is really important to stay inside. Maybe if we stay inside for 2 more months, everything might be better. We don't know that, but we could at least give it a try.
Wow. So Rima, at this point of time, you and me, we are not in their age group. And since we are online and we are broadcasting, this is live, you're not going to reveal our age. However, we are not in that age group. So you and I, how proud when such young people, young women, young people talk like that, I have to decide whether I should, what is right, what is wrong, what is the need of the hour. Rima, how do you feel about the young people making such very important decisions?
I feel very good. In fact, I feel they are quite responsible, they are committed, and they know about the truth, the reality. That's something is very much important and required at this moment, which these guys are actually following it. So I feel very, very proud for them. You are mute. You are mute.
Thank you. So, as I feel that as we grow in the number of years added to our life, we feel, I feel that I used to think like that we get wiser. And the generation, I don't know what A, B, C, D, Z generation you call yourself, I don't know about that, but I can tell you that this generation, wherein we have a Misha and a Niche, the younger generation are much thoughtful, and that gives us so much hope. And I even spoke to a middle schooler in the age group of what 10 to 13, and since the reaction I got is that kids that age are also very, very aware. They just don't want to go out because they want to stay safe. They do not want to end up in hospital, as they said. So I just wanted to add that the youth is, I think you all have always been smarter and very thoughtful. It's just that it's a very good time to voice your opinion and convey the messages. So it does feel so good having you two as my co-hosts. So thank you for bringing these. But we have other things also to find out. If what is our next topic? What is our next myth that we are working on?
Um, well, this kind of relates to what you're talking about, age difference, because I personally have noticed that a lot of people who refuse to wear a mask are actually maybe like older people, and that's because maybe they just don't, either they don't want to face the facts, or they're just they're uncomfortable with, how basically everything has changed because of the virus. So another pretty common myth around wearing a mask is that um, if you wear a mask, you'll get sick from the mask, and a lot of people think that because it's like difficult to breathe, or you'll breathe in carbon dioxide, something like that. But that's another myth again, because that's also not true. Um, in fact, wearing a mask is much safer than not, because um, if you like, there's multiple articles stating this, that um, despite, like, you might feel like hot or uncomfortable, but it's so much safer to wear a mask. You're not going to breathe in carbon dioxide particles, or you're not going to not get oxygen. Those particles will pass through as needed. The mask is for the COVID-19 particles, and the um, particles that will be harmful to us. So the masks work as they should. So they're not going to make you any more sick than you already are, or anything like that.
So to that, Amisha, I have a concern that I want to ask you. Okay, so me being the um, one of the we have two main, people in the house who would just go out, just like Rima, how she's, doing all the outside chores, and Anish is doing, he's by himself. So for me, of course, when I go out and when I'm driving, I'm at that time I am not wearing my mask, because I feel, when I'm going out and I'm for a long time mask is on, and I do feel like it's only feel like suffocating, and I feel like taking off my mask. But then if it's, I see people around, I don't do that. But I, yes, do feel that. And of course I do not believe the fact that, you take in your oxygen and carbon dioxide back and then you die. No, that's not true. Because the reason I asked you, basically, is to confirm what you said, that no, it doesn't make you sick, but it's all in the mind, though. That
Well, it obviously, for one, it's very hot outside now because it's summertime, and we're not used to going around like this, covering our noses, our mouths and noses. But that's the whole point, is that it doesn't matter. Comfort level is not important, right? Or I should say, what we're used to is not what's important right now. What's important is that we all take the steps that are needed to basically get this over with. And another thing is, it is uncomfortable, but the what's it called? The people in the medical field who are trying to save those who are infected, they not only have to wear a surgical mask, but they're wearing several different layers of masks and coverings over their face, and they're all like pinned in place and tucked in place. So, and it takes like a lot of time to just put it on, because that's how many layers they're wearing. So, um, to me,
I second with what you guys are saying. And I would just like to add another thing to that. If you guys think that you are not feeling so comfortable wearing mask around, so what you should do is be smart about it. If you're by yourself, don't wear it. Only wear it when you're around people. So I think this is another myth that's going on, that's kind of related to what you guys are talking about, that people think that you should wear masks everywhere. You should not, basically, of course. That's dumb.
I like the word smart that Anish you used. Yes, be smart. Rima, what do you have to say to that? Do
Yeah,
you people have you heard people saying that, what, if I wear mask, oh my gosh, I'm gonna, turn sick, so it's better I don't wear mask. So
I think that's a mindset people have, and because of that, they are not even wearing masks. And so the count says, the count in Maharashtra, India, is so high because of this reason. And you know what Anish said, I agree to that. That even when I mean, like now I'm not going out, but there was a time even I started when this lockdown got over, I started going out for a walk, morning walk. That was a time, like I was feeling very uncomfortable wearing mask, though I was wearing it. But at some point, I was just taking it out while walking because I was feeling very uneasy. But then, moment times, I was seeing people coming towards me or passing by. So that was the time I was just wearing my mask back so that like it doesn't affect me, or because of me, it doesn't affect others. So that's a kind of thing which I did follow, and yeah. So people think the count itself says, so I don't have to add anything additional to that. Um, that's the reason we are highly affected. And if we talk about our own society, where the place where I'm living right now, in our apartment, in our society, there are 8 cases going on right now. So I'm sure there must be some deviation because of that. The numbers are going high. Can't hear you. You're still on mute.
Thank you. So yes, that's a very important point that um, Anish brought up, and we are discussing this, that how important it is to, uh, of course, it's a mindset, it's a state of mind thought that we think that if I wear the mask and I'll get sick. But then again, if you look at the uh, brighter side, brighter side of it, that you are wearing mask, one, no, you will not die, or I have not died. I'm not a frontline worker. I'm not in the hospital. I'm wearing a simple mask, like a disposable mask, and I did not die yet. I've been wearing that. One time I remember that I was out for more than 5 hours, and interestingly, in spite of not willing to, I was looking for a chance to take this off. I did not die. So which actually I disproved myself, my point that if I wear it, and I did not become sick.
Not to say that there are no exceptions, because of course people who maybe have medical conditions or respiratory conditions, or babies, or well, of course they're not required to wear a mask,
Hmm.
and if you're unable, like physically, actually medically unable, then we don't wear a mask, because
Right.
it's not going to really help you. And um, and it's not like you have to wear a mask 24/7, like you said, to be smart about it. So like if you're outside, if you're exercising or something, it's probably safer not to wear a mask. But then again, you should look up,
Correct.
um, your state guidelines and what other officials have been saying, because different people are saying different things. So, and then there are people who are asking, do I have to go wear a mask when I go to the doctor or the dentist? First of all, you should obviously be trying to avoid unnecessary appointments and stuff like that at the moment. But if you really have to, then of course, if you're going to be around people, basically just wear a mask. And it's the only reason that a lot of people think it's so difficult is because we're not used to it. That's basically the only reason.
That's 100% correct. And guys, really quick, so we've been in lockdown for at least 4 months now, at least in the US, and at least 2 months in India. You guys must have gone out at least a few times within the lockdown. Have you guys noticed people wearing fancy masks and having designs, goofy designs on their masks? What do you guys think about that?
Yeah, yeah.
Not just that, also companies are making this, are like selling specific masks, and
Yeah.
profiting off of this. So I think that it's showing that it's becoming more and more, um, normalized. Like mask wearing and just being safe about all this is at least becoming a more normal thing in society in general.
Do you think that
I like
uh,
Anish brought up that topic,
do
and
you yeah, carry on?
no, you carry on because I'm just going to show you something.
Yeah, so do you think that wearing these different types of masks have any different kind of effects, or do they protect us more or less? Does
Well,
that add to anything?
it depends on the material. Before you buy any fancy mask, you should check that it actually protects you. There are some masks that are really not going to help you if you're going to be around a lot of people. Um, so this goes for everything, of course. Before you make a decision, obviously, like check all of the facts. Um, but I think the um, maybe like the
I
designs have been most helpful for little kids because otherwise it kind of seems like a really weird thing that everybody's wearing masks. But if it's the fact that we're normalizing how they can be like they can look nice, so they're becoming more of like an accessory too, which is again helping it to become a more normal part of society.
Yeah, I see people wearing different masks in beach, different masks when they go to grocery stores. That's so weird.
Yeah, it is because you Amisha mentioned that whatever mask you wear, you have to make sure the basic certain standard we have to follow. For example, this mask that I've been wearing, I mean, come on, it's disposable. We've got
Well,
many
this
of
can
these.
be these kind of masks can be
These are,
reused a few times.
yeah, so these are paper masks. However, if you
It's not
see,
paper.
yeah, it's a paper mask basically.
These are the surgical masks
Correct. These are
that
not,
are, I think most people are wearing these. These are most available at the moment, I'm pretty
yes.
sure.
And these masks, so basically there is a layer there. So there's a layer that will prevent the basic germs that if in the crowd that is going around, and it will prevent. So this is a standard mask that we are wearing. And Anish, you said that. So what do you think about those? So in the beginning, when we did not have any mask, and I had to go out to get grocery, and we self isolated ourselves since the time, I think it was 7th of March, 13th of March, when Amisha's school was closed, college got closed, and they were asked to leave. And so since 13th of March, but however, on the 16th, I had to. So a few days later, it struck me that we are in the house, however, we don't have we never thought that it would come to us. So I had to go out, and we didn't have any mask. And at that point of time, there was no mask. By the time the hoarding drama had already started, that people had started buying, like just for getting the things, that drama, if you remember. I don't know if it's still going on, that hoarding um, tissues, and so many that it's not available for, I mean, come on, bathroom tissue, kitchen tissue, masks, disinfecting wipes, things like these were not available at all. So it was very hard. And just few days, the day it was announced, it's gone. So what Amisha had made with a bandana, very nice looking, beautiful bandana. So we didn't have anything at that point of time.
Well, you need some more.
So Amisha just folded the bandana, and she said, "Okay, mom,
So
you just take this."
you take two, like you take a bandana, you fold it like this, and you take two rubber bands or hair ties at the ends, and
Yeah.
basically you tuck in the ends into each other. I don't have the rubber bands right now to
So
show, but
so
yeah,
yeah, I
it's a
use
simple
it,
solution.
and I actually love it. I sometimes take it as an emergency. However, now many weeks later, we got our masks. Anish, what about you? Because your state was still going slow at that point of time. So can you please unmute yourself?
Yeah, I got my mask. I have these ones. They're made out of cloth, normal cotton cloth.
Okay.
So I use these, and
Yeah.
these work for me. I got my mask really late,
Very late, right?
and yeah, I got it from Amazon.
Oh.
Before that, I used to use a rumal, what we call in India,
Yeah.
handkerchief.
Yeah.
Yeah, I used to use that. I used to tie it behind my head, and that's how I used to go to grocery stores. And I think after 1.5 months, I got these,
Wow.
and since then I've been wearing these. And I got these because these look at least a little bit better than what you have. And I really think that after a certain point of time, masks are going to be a style statement.
Yeah. Yeah. And I think
Yeah,
what to coming back to your point is why these commercial the I will not name these big companies, the fashion companies, because they are not paying us. So we have become smarter. So these companies, they have come up with all these fancy masks. And I have heard, it's just heard from the messages that I've received from my friends who have bought from these companies, that some are just fancy. So it's just, it's a brand name, so everyone's using.
For example, this mask that my dad actually accidentally bought because he didn't realize it was not an effective mask. The packaging itself said fashion mask on it. It's just like a synthetic cloth or something. It's yeah, so
But it did
that's
look,
why it's important to
so
check before you buy.
it gives, does this give me a cool look?
yeah,
Yeah.
Okay.
yeah, it does. Better than the one that you were showing before.
So so I think it's also about people, again.
Trisha, I just want to add to this that, see, it's been almost 4 months.
Yeah.
We have explored, we have tried everything.
Yeah.
Somebody had tried with some painting, somebody had tried in cooking and designing and all. What else? We have done everything.
We've
And
done.
now, like, we are not getting chance to go out of our house. We're
No.
not able to wear designer's cloth, or, we're not able to apply lipstick, makeup. So there has to be something, some that should, show yourself, like you're looking good. So
Yeah.
that feel good moment has been created by
Yeah.
this designer's
Wow.
mask.
Yes, yes, the feel good. Because not every mask that is from these big designer or fashion companies are useful. So again, going back to Anisha's word, let's be, let's use our smarts. Let's use our wisdom,
I
right?
also want to say that the reason, well, this is just like a huge change for everybody, but at the same time, we should also note that this is a huge change for not everybody, it's for us. Because in a lot of Asian countries, especially in East Asian countries, masks are not a new thing. A lot of people wear masks when they catch a cold or something, especially the people around them. Or it's like it's normalized in other countries, so there really shouldn't be any reason that we can't try to do the same.
I beg to differ with you because especially I come from India and
Even in East Asian countries.
East Asia.
East Asia,
Yeah, like China and Hong Kong, people have been wearing masks.
Um,
Japan too.
in their like
Japan too, yeah.
even involves like the mask is part of the outfit. So those are normal. And also, I see a lot of international students at my school before the virus was even a thing. Like a lot of them would be wearing masks. So those who had from East Asian countries, it was just like the normal thing. Um, so it wasn't. It's not really a new thing. It's just may seem new to us because we're not used to it.
but you know what, Amisha? It's so. I come from India. So in India, yes, we do have, as Anish said, rumal, which is nothing but handkerchief. And I think this is basically a handkerchief that we use in India. It's exactly the right size to be a handkerchief, where we use here as we call it bandana. You really didn't have to steal from India's device. Well, I'm not sure about that, but that's the truth. However, in India, we wear India is such a diverse and weather condition, or the landscape you take, right from north to east. We have desert, we have mountains, we have cold places, we have hot places. So a common thing that we wear is a scarf.
Oh
Most
yeah.
scarf is very common in India, and that is what we use to cover if we are sneezing, coughing, or whatever. And however, I have noticed as I was growing up in India, and Rima, I'm sure you would agree. I've never seen in India people cough, and earlier cough. If I get a cough or if I sneeze, I would ever use this to cover it. I would just
Oh
leave
yeah.
it to the air. I've never. So coronavirus actually has done a huge favor to to people like me. Well, now I've been living in the US and I've learned a lot how to cover your cough. Keep it to yourself. I've learned that. But in India, this consciousness has developed, the awareness. You know what? My cough, my sneeze, I better keep it to myself. But I had never experienced that. Even prior COVID, last year I was in India and nobody covers their cough or sneeze. So why
Just
not?
to add to that, Trisha, what you're saying, awareness has increased so much. Now the numbers, if you really see in slum area and chawls, like in Maharashtra, there are chawls.
Slums?
So, like the
Yeah,
people, yeah,
suburbs, right?
slum.
Very heavily crowded places, right?
Yeah, the numbers has actually reduced. The
Mhm.
number of cases are lesser there as compared to high-rise buildings.
Things and posh areas, right? Where we
Posh areas, yeah. So people at that level, this conscious, they are so much aware. Consciousness has increased so much for them that they are taking all kind of precautions just to get rid of this
wow. So
pandemic. Yeah.
this definitely has done a huge favor to
It's
um,
a huge paradigm shift, I would say.
yes, yes, that's
Maybe nothing can do, but Corona really had helped
yeah.
in
That's
bringing the
true.
change.
That's true. Many lives have been lost. However,
Yeah,
also, especially, this has done wonders to the point where now we have become much more aware of, not spreading my germs. I better take care of, keep it to myself and take all the precautions that I have to so that
right.
I do not
And
spread
just
germs.
I also want to add to this that we took it as a joke, but this is the reality. In Mumbai, some high-rise building, like when this people had asked maid servant to come in because for some period they were not allowed to
The
come in and
domestic
work.
health. You mean the domestic
So
health? Hmm.
domestic help, yeah, domestic help. Here we call it buy. So they were all called by their owner to come back, employer to come and start working as soon as this lockdown got over at some point of time. You won't believe those people had started asking for their certificate, medical certificate. Owner, they started asking owner a certificate that all the members from the family, they are all negative, they are not COVID positive. If they can provide that certificate, then only they will be coming and working. And this
Okay,
is a reality.
that is
This is
that's a
really
very
happening. Yeah.
interesting point. Yes, the awareness that we are talking about has led to the point where people we stereotype people that, oh, okay, if you're domestic help, or if you live in slum areas, and it's these are all stereotypes that we need to get rid of and open our
Yeah.
mind, and the awareness, it's working very well. So
Yeah.
this is interesting. And also I have seen people boasting, flaunting their N95s. So and I have read somewhere that N95s are, yes, very very effective. It's a it's better than the regular mask that we are talking about. However, N95 is in higher demand, and yet there's a low supply, right? So if I have, would you, I mean, this is for our viewers. So would you, if you have a 95, great. You think you'll be saved and all these things, but I would rather leave N95s for where it is needed the most, right?
100%. And
100.
95 should be used by the frontline workers, not by normal people. For us, these normal masks should be sufficient.
And Anish, it's not just mask. If we follow certain guidelines, that why to go out if it's not necessary, as you mentioned earlier, that why even do I have to go out if it's not required?
In fact, I recently read not just one but a few sources saying that um, I think the CDC, if I'm not mistaken, recently or public health officials have said, at least in the U.S., that if everybody wears a mask for the next 4 to 6 weeks and practices social distancing and takes all the necessary steps, most importantly wearing a mask, then COVID um, could become manageable, or we could even get past it within 4 to 6 weeks. But the sad part is that just not everybody wants to wear a mask for whatever reason they have.
And that's what where comes Anish's when he mentioned that delayed. You had said that it was supposed to be in June, but now it's delayed to October. And I believe that is what it means by saying that the peak is delayed. Because if we follow the steps, if we wear mask, and
Mhm.
Everybody wears one.
if everyone wears one, right? If everybody wears one, so that can be delayed. So now it is a lot clearer what Anish meant by saying that it's delayed. So great thing going on. So overall, for this point, that N95 masks are useful, yes, it is,
Definitely.
but let us leave it for the frontline workers. I think
Yeah.
we need to do that. And you can buy all your fancy masks, but make sure that it is doing its job, not just because some fancy Avenger picture or something. No, don't have to do that. And also a point that kids, babies don't have to wear mask, but
But the most important thing is, as long as you're following not just one guideline, as long as you are taking all the precautions possible, which means not just wearing a mask, but staying at home when you don't need to go out, and social distancing when you are out, and also washing your hands and just following basic hygiene rules. Because
Yeah.
the only
Yeah.
way that we can actually, um, solve this crisis is if everybody actually follows these rules
follow these rules.
and listens to people who know what they're talking about, meaning frontline workers and public health officials.
Yeah. So, as general public, as commoners, I think that's the least we can do to help delay the process, or help prevent the spread by using masks. And also, um, I also get to hear this, get to read this also. Hey, COVID-19 is going to get over soon, because we've been isolated for a long time, and it's gonna get over. But I think that the awareness that has built up, that has been created within all of us, we should continue with that, right? That no matter what, today it may be COVID, coronavirus, COVID-19. Tomorrow it could be something else, who knows? So why not just maintain the basics, keep basics, wearing mask, washing hands. And washing hands is nothing new. I mean, you would wash hands and get rid of the germs. You would take a good shower and you clean yourself, and you would wash your, some masks are washable, you would wash your masks, wash your clothes just to be safe and just to be keep others safe. So before we come to the end, Anish, we'd like to hear your last few points, your message to our viewers.
I, I would like to tell the people to not be scared. I'm saying that because COVID has introduced us to a few new etiquettes or normal etiquettes that should have been present before, like cuffing with your hands in front of you or your elbows in front of you. Yeah. So this is something like people are doing right now, but before they just used to sneeze anywhere. So yeah, people right now, I'll share an experience. I was coming to Charlotte from Miami in a flight. I remember there was this woman who sneezed, and everyone started looking at her. Yeah. So, and I would like to just say that please don't be scared. If you have to sneeze, then please do. Just make sure you're following proper etiquettes, wearing your mask, and you'll be safe, and people around you will be too. That was my message. Don't be scared.
That was a very good message, Anish. Thank you. Rima, your message to our viewers.
To unmute me. Yeah.
Yeah.
I just want to add that before I share my message, that it has actually taught us a lot of things. It has disciplined our life. We are more connected to people now with our family. It starts from family because, like earlier, we were not giving time to our family. We are more connected. We know about each other more, and we could able to express our emotions more and more. So COVID actually has brought in a lot of good things for us as well. If we have to see that in that manner, I would say, yeah, along with a lot of sadness and a lot of stories which we hear about, we have lost people, but it also had taught us a lot of things. So, and I'm sure we need to continue with this, what we are doing it, because of this social media, because of this lot of virtual digitization, lot of things happened, and we actually forgot to connect with our own family, with our own people. And that's something we started doing. And the message is, let's continue with the flow. Let's go with what is happening. Let's continue with the process. And it's really going to bring happiness in our
That
life.
definitely outweigh the pros of COVID. But yeah, to keep a positive mindset, I would like our viewers to just focus on the pros right now, and yeah, go with the flow. Go with the flow.
Yeah.
Anish and Rima said, but before I summarize, Anisha, your message to our viewers.
I think what's most important to remember right now is that it's not about just you. It's not this is not an individual issue. We have to force ourselves to think a um on a global scale, or just think about our community, or just think about other people. Period. This is this isn't something that we can go about by um thinking like, oh, as long as I'm okay, as long as I don't have symptoms, as long as I don't have the virus. But the whole point of a pandemic is that it spreads to other people. So it's it's so essential to just follow these basic health guidelines, which are honestly really not that hard to follow. Wearing a mask is not very difficult and it's not very difficult to not schedule a hair appointment at this time. You really don't need to. Um, so yeah, that's just what I have taken away from everything, is that we have to think at a on a bigger picture, or we have to look at the bigger picture, and we can't just think about ourselves. We have to think about how we as individuals are members of a larger community.
Wow. Thank you. And just to summarize, COVID 19 is here, and that's a reality. And if you think that it's going away soon, no, it's not. I'm really sorry to say that again, that it's not. This is our reality. Let's face the reality. Use your smarts, your wisdom. We are wise enough. We are human being. Come on. So if COVID is there, then we just need to be prepared. We just need to be prepared to face the truth and staying within the guidelines, following the guidelines, like washing hands, keeping a social distance, which is 6 feet and more, unnecessarily not going out. You know, if you do not have to, just don't go out. Wear a mask. Most importantly, stay covered because you never know if the COVID 19 is onto you. So, with that, I thank my co hosts Rima from Mumbai, Maharashtra, India, Anish from Charlotte, North Carolina, USA, and Amisha sitting with me. And I'm the facilitator, Trisha, and we are in Tandoori Chats with Trisha. Please do support us. We need your support to continue our talks. And the donation link will be added to the description. And please share this talk. And if you want to join us, you can also write to us if you want to join us in our podcast as a guest. So, with that, we come to the end and thank you all. Thank you.
Bye.